Well, good afternoon, everyone, and welcome back to the Systems and Sustainability Echo. My name is Andrea Roche. I'll be facilitating our conversation today. I'm really excited to see so many faces here. I just have a few notes of housekeeping before we get started. Note that these sessions are enabled for live closed captioning if that helps you to attend and hear and read some of the language being used. If you want to enable closed captioning, just navigate to the bottom of your Zoom window and select that Show Captions option. You might need to click on the three dots More menu at the bottom right corner of your screen to see that. And if you're having any trouble accessing captions, just chat Kato with Echo IT and she'll give you some clearer instructions than I just did. Note, as you saw, we are recording these sessions for later distribution through the Be Well Texas YouTube channel. Any information you put in the chat will not be shared on those recordings. As always, we do ask that you stay muted unless you're speaking, and we encourage everyone to speak in these sessions. If you've joined by computer, your mute button is on the lower left of your Zoom window, just that microphone, or if you've joined on the phone, press *6. We encourage everyone to join by video during the discussion portion of the session. It just helps kind of give more ambiance to this virtual space we're all sitting in today. But regardless of how you've joined us, we're just happy you're here to learn alongside us. Because there are a lot of us here, though, we do ask that folks keep their comments brief to allow space for others to speak as well. Also, if you feel more comfortable, you can also use the chat to share your questions, your challenges, your resources, your experiences as well. Just note that whether you're speaking up or sharing information over in the chat, no protected health information is allowed in either space during the entire course of this session. So this includes sharing names, exact dates, relationships, or medical information in a way that could identify a person. To help us with attendance, please enter your name and your affiliation and email into the chat function. We really appreciate your support in helping us capture an accurate record of who's joining these sessions. If you're a Be Well Texas provider, make sure you identify yourself during the session. And if you're joining by phone, email that phone number and your name to the Be Well Texas team at bewelltx@uthscsa.edu so we can make sure to give you credit for attending today. We'll throw that email over into the chat as well. Towards the end of the session, I want you to keep an eye on the chat. We'll send out a link to an evaluation survey. Fill it out to give us some feedback on the kind of content that's going to be most helpful for you, and also to enter a drawing for a $30 Walmart gift card. All right, I'm really excited about today's session. We're opening up with a didactic on strategies for grants to support substance use disorder programs. And then after that, we'll hear some announcements from the CSTEP team and hear a systems case presentation from Work It Health. As always, I encourage all of you to share your questions, share your feedback, and share your guidance in our conversation today. We are all teachers and we are all learners in this space. So with that, we're going to get to some introductions of our hub team and our presenters for the day. Leslie, I'll start with you.
Thank you. Hi, everybody. I'm Dr. Leslie Manson. I'm a licensed clinical psychologist. I'm also a clinical associate professor at Arizona State University, and my primary role is as a consultant. I consult internationally for integrated care implementation, auditing, and sustainability. And my clinical experience is in primary care, substance use services, peer services, and behavioral health. So thank you.
Thanks for joining us. Kathy.
Hello, everyone. Good to see everybody today. I'm Kathy Hudgens. I'm a licensed professional counselor, licensed marriage and family therapist. My background is in integrated care and implementation of substance use treatment programs and behavioral health integration.
Thank you for joining us. Matt.
Hi, folks. Matt Rosa. Good to be with you. I'm a consultant. I work in healthcare and human services, implementing best practices, process and quality improvement. My background is in clinical social work, agency administration, and governmental planning as well. Thanks.
Thanks, Matt. Eileen, our didactics presenter today. Can you introduce yourself?
Yes, thank you, Andrea. I'm Eileen Lepro. I'm a consultant with Lepro Associates, currently doing quite a bit of work in grants development. I think hence the invitation to speak with you today. My background is as a CEO in a QHC in Roanoke, Virginia, New Horizons Healthcare. I was there for over 20 years, and prior to that, worked in public health education and nonprofit management.
Great. Thank you so much for joining us. And also our case presenters for today, Cynthia.
Yeah, hi, I'm Cynthia Gines. I'm the Director of Grants at Work at Health. I lead our grant efforts, which we'll talk about in a little bit. My background, I'm a social scientist. I have a background in education research and a little bit in health research, but I'll pass it off to my colleague, Marlena Lira.
Hi, everyone. My name is Marlena Lira. It's so nice to be with you all today. I'm the Director of Research at Work at Health, which is a startup providing telemedicine-based treatment for substance use disorders. My background is in epidemiology and health policy related to substance use. It's great to be with you all today. Thanks.
Thank you all for those introductions. Really looking forward to today's session. So with that, we're going to get into our didactics. After that, we'll hear some announcements and then we'll go to the case. Eileen, I think you see your slides now. When you're ready, take it away.
Great, thank you all. Yes, so we've titled this From Vision to Funding. I don't have magic bullets. We're going to talk about some practical strategies for grants that can support your programs. Next slide, please. These are my disclosures. I have no financial conflicts of interest, and all opinions expressed are my own. Next slide. These are our learning objectives: to identify opportunities for grants planning development and to look at how we can align grant resources with your organizational goals and community needs. And then we'll talk about pitfalls and challenges of grant writing and grants management and what to look for. Next slide. So why are we talking about grants at all? And what are the benefits of seeking out and receiving grant funding to support your program? The most obvious thing we hear is that it's free money. And while that's true to an extent, it's not a loan. There's no payback expected. You do have to meet certain requirements and meet the goals of the program that you laid out in order to keep the funding. So it's free money provided that you meet all of the requirements. It's really useful. Grants are really useful for new program launches. You can use that as startup money for innovation and pilot projects. It allows you to cover the initial investment for staffing and infrastructure and such, so that you can increase your capacity to generate other funds or to generate earned revenue down the line. So it's a great way to launch a new program with a grant. You can also look at grants as a great way to expand a successful program. So if you're poised for growth, you've maxed out the resources that you have in your SUD program, and you know that you need to expand to meet more need in the community, then a grant is a great way to receive the funding to do that. And then grants also increase your awareness and your visibility and your credibility in the community, both with partners and other community agencies, but also with the funders. So the more that you're able to talk about your grant and your success, the more visible you are in the community and the more likely you are to attract funds later on. The bottom line is it makes a positive community impact. That's the goal of every grant. Next slide, please. So this is a quote that I found on Instrumental that I thought was really meaningful. I really love especially the second part of this, but the statistics that they've looked at are suggest that on average, for every, say, 10 grants that organizations apply for, they'll receive awards for 1 or 2 of those, because organizations are often unsuccessful in obtaining the grant award because they're practicing what's called episodic grant seeking, or chasing the money, chasing the dollars, fishing for funds through an intermittent series of desperate gambles. And sometimes it does feel like that for those of us in the grant writing world, that we're rolling the dice every time that we submit a grant. And that's not the most appropriate approach to being successful with your grants, especially for grants for sustainability. So what's the antidote to that? Next slide, please. Plan. And that's what I'm going to spend some time talking with you on these next couple of slides. We're going to talk about a grants development plan and why that's really important for your success in the long term. Next slide. So most organizations wouldn't skip strategic planning on a regular basis, and I contend that the same should hold true for grants development. But it often is more of that scattershot approach that the quote alluded to earlier. So we need to develop a logical approach to grant seeking by creating a grants development plan. These are some of the important elements of a plan. The first thing to do is to assemble your grant team. And this is before you even receive the notice of an opportunity, but it's to plan ahead again in a strategic way. So on your team, you want it to be cross-functional with program and content experts, obviously, because they're the ones responsible for implementing the grant. It's really important that you have a finance or a budget person at the table with you from the beginning. They will ask hard questions and they will give a reality check, and that is really important in order to build a solid plan. It's also helpful to have people at the table, even if they're not content experts, who have skills in envisioning processes and looking at the details, because they will help you to look at the implementation and the design of your grants when the time comes. So it's good to identify who those people are and bring them to the table. Obviously, you're going to have a facilitator of your team, which is quite often the grant writer, not always, but quite often. And then sometimes overlooked is to have somebody from senior management. It's really important that you get their buy-in and their investment and especially their understanding of the plan from the get-go. Otherwise, there can be opportunity to drop support or to sabotage even sometimes if they haven't been involved from the beginning and don't understand what the plan is all about. You want to look at your organization's strategic plan and make sure that the priorities in the strategic plan are aligned with the priorities in the grants development plan. If the two aren't matching up, then it's probably not a great idea to pursue grants, certain grants or certain funding for certain program areas if it's not part of your organization's strategic plan. And then obviously you want to identify gaps in needs in the community through a close study of your needs assessments, whether they're internal to your organization or external in the community. Next slide, please. Okay, researching potential grantors can be kind of tricky, and that's another whole presentation for another day. But I thought it might be interesting to talk a little bit about where you find these funders. Sourcing grants can be frustrating. So I'm going to mention a few ways to look for grants just to get your wheels turning. We're not covering the whole waterfront today, but many of you might be familiar with grants.gov. That's a clearinghouse for most of the large federal grants. And anybody can go onto grants.gov's website and search for grants. Be aware, if you haven't done that before, that it covers a broad scope of program areas. And so you really need to narrow the scope in your searching and use keywords and know how to do the search. And that's something that I can help with later on if you're interested. There are paid subscription programs that collate grant opportunities into databases, and you pay for those on a monthly or an annual basis. Some of them are better than others. Some are just duplicating what others have already done. So a good bet is the Chronicle Philanthropy and or the Foundation Center. Those are a couple that have been around for a while, and they have their own grants databases, and they're pretty easy to use. Instrumental is a grants management software. I mentioned that earlier. I had found that quote in one of their publications, and they also have a grants database for sourcing grants. You also would want to look at your membership organizations, associations. They often publish grant opportunities. And then if you're looking at foundations, you can go to each foundation's website and sign up to receive emails of when their funding opportunities arise. Professional organizations and networks can be good sources too. So you just want to keep your ear to the ground with the networks that you're involved with, and don't be afraid, don't be timid about bringing these ideas and sources to your leadership, because as tied in as you might think your grant writer or your senior leaders are to what's happening out there, quite often we're not. So it's really helpful to I used to welcome when people would bring me ideas for grants, because I really couldn't have my eye on it everywhere. So everyone can help in that regard, everyone on your team. Another thing to do is to examine other successful grants for SUD purposes. So you can do a Google search and look for press releases and articles and case studies of organizations that have had successful, replicable grants, and you can learn from that. You can also look for their sources. Where did that funding come from? And then kind of track that, so that that might be a source for you as well. You also want to look at grants that your own organization has done in the past. So there may be some internal successes that you want to go back to and study and pull out the parts of that that worked really well. Recruiting partners with shared goals is very important. It's something to think ahead about. Even before you get a notice of funding opportunity, it's important to think about who you're going to tap to be partners in your grants or partners in your program, even if they're not directly involved in the grant later on, and start brainstorming that with your team so that you can approach those organizations or those partners, whether they're funding partners or whether they're program partners. And you want to be able to put that into the plan so that it makes it easy when you go back and look at the plan to see who you've talked about as potential partners. And then commit the plan to writing. And it doesn't have to be anything fancy. You can get a grants management program. You can use your strategic planning model as or template, or you can just, you can just go very basic. I use a spreadsheet, an Excel spreadsheet, and I have columns for the topic areas or the particular need that we have, and then various grant sources. And then for each grant source, I break that down into their specific criteria and requirements. It's helpful at a glance then to go back and look at that. You would include the timelines for the grants, deadlines. You might want to color code grants that have certain deadlines coming up soon. You might want to build in calendar alerts. There are any number of ways that you can do this, but it needs to work for you and your team. And it allows you to go back and easily identify upcoming grant opportunities. You need to make sure that somebody is dedicated to keeping the plan fresh and active, so that your whole team or one person on the team is always scanning the environment for new grant opportunities. And then you want to maintain some flex in the plan so that you can be nimble and responsive when the time comes to actually sit down and put a grant application together. Next slide, please. So having a plan in place like this allows you to be better prepared for those opportunities that will arise. And you won't get caught off guard, and you won't be fishing for money, as we say. Especially in the area of behavioral health and substance use disorder, it's receiving so much attention recently, and there are increasing investments at all levels of grants. So I wanted to just mention a few recent examples, just to give you an idea of where some of the grant funding is coming from to support SUD. Back in January, SAMHSA announced a notice of funding opportunity with a price tag overall of about $73 million that was going to be disseminated across 5 different program areas. So drug courts, adult reentry programs, MAT, emergency department alternatives to opioids, and then the STOP Act, which is a prevention of underage drinking initiative. And in July, they just announced those awards, and it's part of the Biden administration's efforts to address the nation's addiction and overdose crises. but it's possible that this would be offered again in future years. So this is the kind of thing we would put into a grant plan, and we would put an alert in on the calendar to look for this again in the future in December, January, probably on a similar time frame. But if not, to get on that SAMHSA website and try to sign up for email alerts or go through grants.gov to search for that. There was a local example in Virginia that I wanted to mention. Carillion Clinic, which is a large hospital and healthcare system in that part in the Roanoke area of the state. They also have a medical school. In March, they received a nearly $2 million grant from the Virginia Department of Health through its injury and violence prevention program. And what they're doing with that funding is launching a statewide expansion of a model that worked for them called, it's their emergency department bridge to treatment program. So what they'll be doing with that funding is spreading it to 7 other early implementer EDs across the state. And that's likely to attract more support later on. So that, even though that's not a huge amount of money to take that show on the road and replicate that program, it's going to increase their visibility, their credibility, and it's going to attract interest from potentially other funders and other revenue sources. So it's really important, and every investment like that can make a difference to your sustainability down the road. There are a lot of other smaller grants that you can, well, and sometimes large grants, but foundations and corporations can be good sources of grant funding. And so I looked at one as an example. Kermes, which is a global biopharma company, has an inspiration grant that they award every year $500,000 to various nonprofits. They're usually for each award in the $25,000 to $75,000 range, but they target underrepresented and under-resourced communities, and they to address the needs of people living with addiction, serious mental illness, or cancer. So I'm assuming that the pharmaceutical side of the company produces medications for those purposes, but they also have this community benefit as part of their giving program. And then there are workforce grants. So for instance, HRSA has a Bureau of Health Workforce that is providing grants for training, behavioral health and substance use disorder professionals and paraprofessionals to increase the supply and distribution of workers in these fields. So that's another one to look out for, because you won't be able to provide the services if we don't have the staffing. And so workforce grants are a really useful way to, again, maybe to pull together different sources of grant funding for one program to be most successful. And then one that we should all be looking out for is the $50 billion in the opioid settlements that have come from the big pharma lawsuits. They've only distributed about $3 billion of that so far for the first 2 years of the program. I believe it's a five-year effort. And they are going to states, and then states are in turn going to sending them to local governments or to commissions and that kind of thing. I looked up Texas's allocation, and Texas received $121 million for years 1 and 2, and Virginia just $6.2 million in years 1 and 2. But there's a lot more coming down the pike, so that's an important one to keep an eye on. Okay, next slide, please. So now you've found some of these grant sources and some actual opportunities. And so the grant application process is live. What next? The next 2 slides are going to cover some of the essential considerations for actual preparation of grants. So the funders' goals are very important, because their goals and philosophy need to align with yours. And if they don't, then it's probably not a risk for you to pursue that grant. Grant funders are very serious when they set parameters around what they'll fund or not fund. And common complaints from funders is that the applicant obviously didn't pay attention to the funder's interest and motivation. So don't compromise your own goals just to chase those dollars. Also need to look at the timeline very critically. Is it realistic for you to submit the application, perhaps wait on the award several months later and then implement your program after that. Sometimes there are long lag times. Sometimes the turnaround is so short that it's not realistic because you don't have time to pull it all together. That's another reason for planning in advance and maybe having some grant templates ready to go so that you can plug and play and be ready. But sometimes there's not enough time to either build the infrastructure or recruit the staffing that you need to implement the program. So give a lot of thought to timeline. It's a make or break element. And then program design is the guts of the grant application itself, the who, what, when, where, and how of your grant. So you need to look at infrastructure, staffing. You want to always incorporate evidence-based practices. You have to look at the practical implications of changes to workflows and processes within your organization, how that will affect the staff who are already there. How will you engage the community and the clients or the participants in the program? And then what's your evaluation design? That needs to be robust enough that you can show impact and effectiveness. As far as collaboration, that's often a required element in any grant. Are your collaborators, your partners in the community going to be directly involved in the grant program, or will they just write a letter of support? That's also important. Will they provide some in-kind services, accept referrals from you? Will there be an actual cash investment? Sometimes collaborators are looking for an opportunity to partner up because they can't do all of it, but you can sometimes work out a great collaboration with colleagues in the community, and you can each kind of have your niche, and the funding can flow perhaps to one organization, but then you can contract with the other organization. And that's a way to show that you have matching funds and support. And collaborators are not limited to just your conventional partners and colleagues in the community. You want to think about building relationships with local government, state legislators, your congressional representatives, advocacy groups, membership associations, chambers of commerce. All of those kinds of individuals and groups can have influence on policy and funding streams. And so again, this is a case where an early investment in building relationships and good work communications with others, becoming a subject matter expert to the folks with the influence could award funding later on, or could be a path to receiving that kind of support in the future. Next slide, please. Okay, budget is an obvious one. Again, this is where the finance and the budget experts come in. You need to develop a budget that's realistic for service delivery. And you need to think about in advance your post-grant sustainability. Most grants require that you address this in some way. And it can be hard to know if you're writing, for instance, for a 3-year grant and the funding will go away at the beginning of the 4th year. It's hard to predict where will your funding replacement come from at that point. And that's usually why some of these multi-year grant programs give you sufficient time to develop that those revenue streams and the plans for maybe seeking additional grants. Maybe you'll have fundraisers. I know one of your previous speakers had talked about that. Perhaps you have some donors who are interested in your subject, and you can work with your foundation or your development, fundraising development folks to tap into some donor support. Will you be billing? I know you probably had presentations around that, and that's how in the health center world, that's typically how we build out our sustainability plan, is we gradually ratchet up our capacity to serve more patients or clients or program participants that through billable services. Organizational commitment is very important because, again, if you don't have, for instance, your leadership, your board behind this program and supporting it, things can take a turn later on. You want to be sure that you have the infrastructure and the technical resources to carry out the program. We could have a very pie in the sky grant plan or grant application, but not have thought about the facility space, and we're adding 10 people and we only have space for 3. So those are the kinds of things you absolutely have to tackle when you're preparing grants. Are you reassigning staff from one part of your organization to this program? And then if so, what's going to happen where those staff were? Are you adding staff? How long will it take for you to recruit and get those staff ready to go? What's your history of successful grants with your organization? If there's been several such grants in the past that have worked out really well, then you know that your organization has the skills to manage those grants. It's a good predictor of success. And it's also critical to post-award sustainability. How well positioned is your organization to pick up expenses should the grant funding go away, or to pick up part of those expenses while you're trying to build your revenue streams or attract other grants? The organization has to be committed to the what ifs at that point. Marketing and communications is very important, both internal to the organization and external whenever you get a grant. Everyone in the organization needs to know what things might change as a result of the grant, what new services are being offered, how those services are going to affect workflows. You also obviously want to attract participants and enrollees in your program, and so the communications externally are as important. Referring organizations need to know what you're doing with this new program. So don't underestimate the importance of it. If you're out of sight, you're out of mind. You want to trumpet your success, stay in front, be seen as a leader, build advocacy in the community, and keep the clients and the community engaged. And then competition. Assess the relative risk benefit of applying for each grant based on others in your regional market who might also be applying. This is again a place where maybe you want to talk about collaborating instead of competing. You also want to look at the number of awards and the dollar value of each award. So if you're applying to a national foundation and they give out 4 awards a year, and they're in the $50,000 range, that's a conversation you need to have of and how complicated is the grant to submit? So is the juice worth the squeeze in that case? It's okay to sometimes take a pass and say, this doesn't look like it's going to be a good risk for us. And we'd rather invest our time and our energy into something that has more potential of success of actually receiving the award. Okay, next slide, please. And what are the potential pitfalls? Now you've been awarded a grant, congratulations. But there are some things that can happen after the grant funding arrives. And it's important to think about all of this in advance. What if you have personnel changes in your organization? You have a transition in leadership and a loss of support, and the new leader says, I don't know anything about this, and I'm not interested in us continuing to carry this out. Well, obviously you have to meet grant requirements, but are you going to have the support of that leader to then look for that those sustainability options, or is the program just going to go away? What if you have program staff changes and they're critical to delivering the service, or you have a vacancy that doesn't get filled for a long period of time? That can interrupt service delivery. And the grants administration is very important as well. If the finance manager is absent for a number of months due to an unexpected emergency situation, somebody has to be tracking the expenses and helping with the reports and submitting invoices and billing and so forth. Budget is an obvious one, can be a pitfall if you go over budget for obvious reasons, or under budget can also be a problem. So if you're over budget, where's that extra money coming from? Your organization may have committed, but not to the extent that you may need if you've really underestimated what the expenses are going to be. If you're under budget, it means you might be pressed at the last minute to dump a bunch of the grant money into things you don't need. If you've had a plan to hire someone or hire 3 people and you've only been able to hire 2, and that third position is just staying open for a long time, you want to get ahead of that and talk to the funder right away. You want to alert them whenever there's that kind of a change. budget surprises can hurt your chances for future funding. If program participants don't respond, don't enroll at the rate that you expected, that's obviously going to hurt your program. You're not going to meet your objectives, and you're not going to have the opportunity to generate more revenue. So again, get ahead of this early on, tweak your processes, your marketing, try to improve those numbers. Partners can back out sometimes due to shifts in their priorities or budget changes or leadership changes. So you want to think about that. And then in your environment, a crisis could divert attention to something else. COVID's a perfect example of that, for instance. Or some of the shifts in the political climate could reduce or cut off support for your program. Okay, next slide. And this is essentially the last slide. I just wanted to summarize. Plan before the grant opportunity presents itself. Not everyone wants to be a grant writer or can be a grant writer, but everyone can be invested in the process. So you have a much greater chance of success with a cross-functional team designing the program and evaluating the results. If you do something well, expand upon it, focus on your strengths, leverage those skills to prove the return on investment to the funder. If you have a new idea, don't be afraid to innovate using a grant. Remember to build those relationships. Partners and collaborators are crucial to achieving your goals, and continuously communicate with them and work with others. And then plan B, always think about what might go sideways and have a plan of response just in case. That doesn't mean that has to be committed to writing, but that should always be in the back of your mind and something that you talk about as a way to prepare for anything that can go wrong, and it can happen. Okay, next slide. These are the references that I've used for some of these topics in my presentation. So hopefully you'll have an opportunity to check out some of those in more detail. And final slide. Thank you.
Thank you, Eileen. That was a really, really terrific presentation. And for those of you who might have been trying to jot down those resources, just know that we will make the slides available after the session. I want to open up the room if anybody has any questions for Eileen. Yeah, Lindsay.
Hi. So it's not really a question, but I just want to say that like going to like local Ross groups and things like that can really help like get a feel for what's going on in your community. And I know that like with Mesa, I live in Williamson County, which the Commissioner's Court got got some settlement money, but it wasn't like, I guess it wasn't, I don't know how all that works, but it wasn't what the state got. So it was separate, and so that wasn't like put out there for grants, but because I knew the commissioner and we worked together, I was able to, get that information and be able to create a grant to even apply for, right? So like knowing your local government is very important, and going to those groups and creating those relationships can be essential.
Yeah, it took us a few years to get to the point where the city manager or the mayor, or somebody from council would actually call us and say, hey, we've got some funding and we want to talk to you about it. So again, it's an investment early on that might yield years down the road, but it's worth that.
Yeah, I also appreciate the attention given to building up relationships, and you don't wait for a grant call to drop to start making those relationships. They start way ahead of time. And I think that also feeds into sustainability planning too, that ability to say there's a community that is asking for this and ready to partner to make it happen in the long term. Well, let's move on. And Amanda, thank you so much for sharing information about the opioid abatement settlement funds there in the chat. And I do know we have an upcoming ECHO session from CSTEP on that. So thank you for the resource. If you have more of those questions for Eileen, keep them coming. You can use the chat or share that information by unmuting as well. But let's go on and do some announcements from CSTEP. Thank you, Cato. So the Center for Substance Use Training and Telementoring provides high quality education in best practices for responding to substance use. CSTEP can help enhance professionals' knowledge and self-efficacy to screen and treat and make referrals for people with substance use disorders. Learn more about this great program. Visit cdfstat at utesco.edu. We'll throw that link over in the chat, of course. Next slide. We want you to be able to claim your CME for attending and participating in today's session. So this is a really easy process. You just have to text this number by midnight tonight. So text attend followed by 100-94063 to the number listed on the screen. I don't expect anybody will remember what I just said. So Cato has also helpfully put that information over into the chat as well. Next slide. Save the date for an upcoming Texas session. This is going to be on August 31st. That's a Thursday. Registration is going to open soon. And to learn more about this series, you can visit texas.org/sessions. And next slide. We hope to see you next month at the Systems and Sustainability Echo. We'll be learning more about implementing the crisis response plan model within an SUD organization. So that'll be August 24th at 12 p.m. Central. Hope to see you then. And I think that's all the announcements I have. Thank you, Cato. So we're going to turn over to our case presentation for today. And after the case, we're going to open up the room for questions and conversation. And just a reminder, we want to hear as many voices as possible. So please use your unmute or use the chat to share your experiences, your suggestions, and your questions. I'll start with just an intro to our presenting team for today. With us today, we have Work It Health. Work It provides integrated opioid use disorder and alcohol use disorder treatment via telehealth in the states of Texas, New Jersey, Michigan, Ohio, and Florida. It's a for-profit organization with funding coming from some blended sources, including billing and philanthropic sources. Cynthia and Marlene, we are very grateful you've joined us today. To get us started, I'll ask that you share the challenges you're experiencing and the questions you have for the learning community today. Very basically, how can we help you? And before you get started, I just want to throw this out to the community as well. As we go along, if you have questions, if you have suggestions or ideas, feel free to jump in with your thoughts and your experiences all throughout this conversation. So back to you, Cynthia and Marlene. Tell us more about your challenges and the questions you have for this group.
Great. Thank you so much, Andrea. And it's great to be with you all today. My name is Marlena Lira. I'm the Director of Research at Work It Health, joined by Cynthia Jimes, who's the Director of Grants. And we're so excited to get your feedback and kind of talk through how we've used grant funding to tackle a pharmacy barrier problem we've been encountering in the telemedicine landscape for substance use disorder treatment. And also kind of a second layer, there's a higher level layer of pharmacy barriers, but then kind of implementation challenges that we've been working through along the way through this grant support. So just before I get started, I just want to shout out to Eileen for your excellent presentation. So much of what you were speaking about really resonates with, I think, our experience of how we conceptualize and work on grants at Work It Health. And I think what we'll talk about today kind of speaks to the rubber meeting the road and clinical challenges and processes that we've been working through in order to meet our grant obligations. So before we kind of launch into that, Andrea, you kind of gave a nice overview of the treatment that we provide at Work It Health, and just want to kind of round that out. So as you mentioned, we're a health startup. We provide telemedicine treatment for opioid use disorder and alcohol use disorder in 5 states. Our clinical model includes medications for substance use disorders. We also have courses within our website and our app that are based on cognitive behavioral therapy. And we also have mutual and therapist-led support groups as well that are all done through video visits. So it's like Zoom appointments for your medical and behavioral health care for substance use treatment. About 2/3 of our members are served by Medicaid, and the vast majority of our patients have opioid use disorder. So that's really the large population that we serve. It's a smaller percentage that have alcohol use disorder. And then we also try to treat comorbid conditions as best we can through telemedicine. So that will frequently be things like anxiety, depression, hepatitis C. So kind of with that said, I just wanted to lay the groundwork. I'm going to pass it over to Cynthia, who can kind of talk through how we approach our grants and kind of the background on this challenge. So take it away, Cynthia.
Great. Thanks, Marlena. So yes, so Eileen, your presentation was great. It brought forth so many things that resonate. So about 2 years ago, I would say Work at Health really started getting serious about its grant strategy. We've always had grants since we were founded, but we really wanted to think about grants more strategically and really align them to our North Star objectives so that we don't kind of dilute the core mission, which is to kind of effectively serve traditionally underserved populations in accessing treatment. And so one of the first things that I did was to try to map those opioid kind of allocations from the federal government and then into the different agencies like HHS and other agencies, and then into the states and then to the local entities and regions to see where we might be able to intersect. So mapping that flow of that funding was really helpful to us. So seeing where we might intersect in terms of like, are we aligned? Do we meet the requirements? Are we eligible for those grants? And then how do we align to those grant opportunities in terms of our North Star objectives and where we really want to go with the organization? So we kind of have two big buckets of our funding. One of them is around treatment access. So really using the state opioid response grants to help individuals who don't have insurance in accessing care. So we have a few grants in that realm, Be Well Texas being one of them. We have one in Michigan. And then we have another bucket of our grants, which is around innovations. And Eileen, you kind of framed it as new program launches. But we really try to think about ways we can innovate on our telehealth technologies so that we can better serve our patients at a reduced cost and reach more patients, including rural patients and other special populations. So for example, we have a grant with NIDA, the small business, well, it's actually a contract, a small business innovation research contract, where it has allowed us over the last 2 years to really innovate on our telehealth model. And we've built out a PDMP that's cross-state. We've integrated a robust e-prescribe system into our EHR. So there's all these sort of innovative pieces that we've been able to sort of stand up as a result of that NIDA contract. And then we also, another example of one of our innovation grants is with the Ohio Mental Health and Addiction Services. So that is an innovation grant that allows us to provide wraparound care to folks with SUDs and comorbidities. We've also looked at grants, like some of you mentioned the HRSA grant, so their MAT expansion grant, we looked at that, and then Office on Women's Health grants, where they were looking at maternal health and SUD. So we kind of really try to cast a wide net, but also really paying attention to the alignment between these grants and our strategic priorities. But one of the challenge.
Oh, I want to make sure we don't lose that thread, because I'm guessing, Leslie, you have a thought around there. If it's all right, Cynthia, I'm going to jump to Leslie for a second.
Oh yeah, and Cynthia, it sounds like you were just going to where I was going to ask, because it was great to hear some of the use of the innovation grants, but you had just transferred and switched you to saying something about the challenge. I wanted to make sure, because I know of time, what we could do to focus in on that challenge. What have you experienced related to that? Go for it.
Thank you. Sorry if I went off on a tangent there. So yes, so one of our grant-funded innovations is medication shipping. And so one of the challenges we looked at over the past year in particular is when we move forward on these grant-funded innovations and grant requirements more generally, how do we make sure we're really integrating those well into our clinical workflows so that we aren't overburdening our clinical team with these new grant-funded innovations? And one of them is our medication shipping innovation that was NIDA funded, but it's also part of our Be Well Texas grant. And I'm going to let Marlena speak to that challenge and how we work through it.
Yeah, so basically a lot of our patients have pharmacy barriers, whether it's because of supply issues where pharmacies don't stock buprenorphine, or pharmacist-related stigma due to telemedicine prescriptions of these medications. But our patients really experience a lot of burdens regarding to pharmacies. So we launched a program to deliver medications to patients directly in order to try to subvert this and kind of get around the problematic pharmacies. So that was the challenge we were trying to solve. Along the way, though, we encountered challenges. So basically, the first issue was identifying a pharmacy partner that could pull this off. We were able to work through that. We found a pharmacy in the Dallas-Fort Worth area that can do same-day delivery in that area and up to 2-day shipping kind of within Texas. And that's been amazing. But kind of the challenge that we've been working through is kind of how to expand this and how to grow. We've identified clinical champions to help us. So we have a medical assistant and one provider who are really kind of leading the charge on this initiative. The issue is that it requires a lot of time from the medical assistants to be coordinating these prescriptions. So basically, this champion medical assistant is on the phone for about an hour a day with the pharmacy partner, and they're talking through every single prescription, making sure it gets coordinated with the members directly, and basically seeing the prescriptions from start to finish. It's a lot of hand-holding, and we're happy to do it because we're helping people who would otherwise be experiencing real barriers. But I think there's this unexpected burden of the amount of time it takes to really grow this initiative, get buy-in from providers and staff beyond these champions in order to really integrate it into their normal clinical workflows. We sent a survey to our patients in Texas, and over half of them said that they were interested in this. But we really have one provider who's leading the charge, as I mentioned. So we would love to hear your feedback. Has anybody done anything like this around medication shipping to begin with? And also just any experiences around growing programs that are kind of new, different, might take a little bit more time. We would love to be able to offer this to people in all states. So that's kind of where we'd love your feedback or thoughts. Thank you.
Yeah, that's great. And Leslie read my mind and gave another version of that question to the audience. Let's open it up. Thoughts or suggestions from the group? And even if it's not specifically around mail order prescription services, even that other work of sort of getting broader buy-in and scaling up programs, I think that would be really helpful feedback here as well. Yeah, Eileen, I saw you unmute.
Eileen, yes, I was going to say, Eileen.
I was just really thinking about this specific issue and wondering if like a pharmacy benefits management company might be interested. I don't know if they ever, but they're the next. So you're working with a pharmacy, I assume, not a
Yep.
huge, if it's an independent or a retail pharmacy, maybe the next layer up could have an interest in demonstrating.
Yeah, so would that be something like Express Scripts, like a program that handles? That's a really interesting idea. Yeah,
from the health center side, but
yeah,
they have lots of resource, and I don't know if they share it in this way, but it might be worth talking with them.
That's a really great suggestion. It was so hard. We went through like 10 potential partners before we found this pharmacy that wanted to try this out. So many pharmacies were concerned about the number of controlled substance prescriptions that they would be filling, even though there are actually, I think that's actually not a real concern. There are no real limits on the number of controlled substances that a pharmacy can fill, but there was definitely concern. So we kind of just latched onto this pharmacy, but that's an amazing idea. And it might also help to expand the members. I'm just thinking about insurance plans that could be covered.
Right. And some insurers also have, grant or giving programs. So that might be worth looking at.
Oh, thank you for those
Leslie.
suggestions. Yeah.
Leslie, I saw a lot of nodding in the chat.
I was just going to say that because some insurance companies do that, and they actually, Evernorth now owns, I think it's Express Scripts. Evernorth is the new, someone remind me, Evernorth they just changed their name. I don't know why they did to Evernorth. I'll look it up, tell
Yeah.
everybody. I also put the vendor list to companies for the management in the chat. That might be helpful.
Thank you so much. I think, I think the providers are really excited about this, and they know that their patients experience these barriers. I think it's though that there's just such limited time in these clinical encounters, and there's already so much to do. It's the idea of, having one more thing to kind of talk through. And I think that this is very common across medical systems with new interventions or new programs that are rolled out. So any thoughts from folks about how to kind of make that, new ask on providers a little bit more manageable?
What kind of support people are you connecting with instead of just the direct providers? Because again, there are systems that, and I know that there are a couple of people on here who have built, the support systems around the provider to create that sort of pathway. So the workflow would not go directly from that provider. That provider would be the consultant part of that. And I know that we don't have a whole lot of time, but Aisha's on here. And I know that in Virginia, we have a fairly robust framework for that. And so it wouldn't be just on the provider to make that decision and then feel the burden of it.
That's great. Can you talk more about what that kind of looks like in practice?
Oh, so you would connect to the person who coordinates those visits and the who coordinates the all of the services.
So the
that
navigators, case
patient,
managers.
yes, because I think you're connecting to the providers, and they get a lot of solicitations. And I
Right.
would even then go up to the leadership, and then I would also map. If they are having difficulty themselves, then start helping them map that so it fits for what you can offer. But I think there are people on this call too who have actually had to do that within their own organizations to fit some of their own objectives that way.
Yeah, that's great. I love the idea of just really going higher up in leadership, trying to figure out various clinical operations, workflows, and seeing at which points this can kind of be integrated to minimize the burden on providers. That's a great suggestion.
Other tips or strategies from the group around encouraging that buy-in at multiple levels?
And I put a note in the chat just in case folks are looking there. I'm wondering what folks do just on general to help kind of cheerlead, to motivate your providers on new workflows, on new unique, starts. And just wondering if folks have general recommendations about what you do related to that. And then if you use maybe provider champions in specific ways to do that.
Leslie, was that a question that was for the general group, right?
Yeah, that's for the general group. If folks have that, because I think that really helps. We use a lot of champions, identifying specific providers, right, to lead. And then that really helps to do encouragement in specific ways. And then I typically use very specific ways to almost do, I call it cheerleading, right? It's just a normalized term. And really look at what are those small ways that I can do cheerleading to really help with new initiatives. And how can I really motivate people? And that's looking at everything from praise to looking at little type of toys or doing games. I've often with new initiatives that are challenging, even with new metrics, actually doing competitions can really help with people to start oh, I want to do more of those or write more of those or refer more people to that. And then people win prizes. But I'm wondering what other people do here in the community.
I know that we're running out of time and Matt needs to do his summary, but if you have, any type of suggestion for this organization, please, let them know, jump in there, and then you have their contact information. But I didn't want to take your part there, Andrea, but
No, I keep the suggestions coming. I can throw in one other thought, which is celebrate those successes and celebrate them regularly and give that feedback. I think that can help to build momentum. That's some work. Thank you, Kathy. Actually, that's a great segue. throw those comments in the chat or continue to bring them to the community. Matt, I am going to turn to you now if you can give a wrap up of our conversation today.
Sure. Yeah, I think at the heart of this conversation is planful, mindful teaming. I say team as a verb, teaming as in to team, being proactive in developing those relationships. You all at WorkIt, we're talking about those workflows, for example, being proactive about developing those workflows on the front end before we're struggling with them. Eileen was talking about the need to plan, the need to develop team, the need to find those partners and work collectively with those partners on the front end as much as you can. And the WorkIt folks, I think, were really reflective of that in terms of working to find those places where those innovations can match with your partners, and the partnership building, both internal partnerships, which you were talking about within your own team, and then external partnerships as well, addressing the workflow challenges and addressing everything else. Again, back to team. This stuff needs to be done with proactive teaming, and that's how you can be successful with your grants acquisition and with your grants management and achieving your goals through those grants.
Great, terrific wrap up. And thank you, Kathy, for the comment too in the chat around helping to identify the patients who are really going to benefit from this and how that helps meet their organizational goals for health outcome measures as well. Cynthia, Marlena, thank you so much for sharing about WorkIt Health with us today and bringing those challenges to this group for conversation. Eileen, a really, really wonderful didactic that I plan to revisit in the recording as well. Thanks to all of you for showing up to these sessions and sharing your experiences and your questions. We hope you continue to do that. I want you to make note in the chat of those CME instructions and how to access CME by texting by midnight tonight, as well as the post-session survey to give us some feedback. We hope to see you at our next session, Thursday, August 24th. Have a great rest of your week. Bye, everyone.
Bye, everyone. Thank you.